COVID-19, boy, the health department, since our first case here, has worked tremendously hard. One of the things that has been very beneficial is the fact that we took on the health equity approach before COVID-19. And so what it does is it allows us to ask who's missing, what voices haven't we heard, who do we need to reach out to. But the truth of the matter is racism is a public health crisis. And COVID-19 has highlighted how systemic our issues have been. The African American community have endured years and decades of racist policies, which has trickled down to also other populations. In 2018, when Waterloo and Cedar Falls was ranked as the #1 worst cities for African Americans, was something very difficult. But it's important that as a community, we take an opportunity to utilize bad news to do something great. And so it's important for us to ask ourselves, why has that occurred? Why haven't we made the change? And so that really stems from having structural racism and people facing barriers in terms of adequate housing, in terms of health services, in terms of education services. And so we have to recognize that it is the root causes of our problems in this community. And so our responsibility is to really educate ourselves and also be willing to be an anti-racist. How do we educate the community? How do we educate our stakeholders in understanding that this is a systemic issue and we have to work together? People have to be informed and so that they can make the best decisions for themselves and their communities. And so community partnership is so critical in this work. The health department recognizes that we cannot do it alone. This is a partnership that I believe to be very critical, and we want to engage. We want to hear the different sectors, their experiences, their successes in addressing equity, and also the things that they are intentionally wanting to improve. And then also you have organizations that might not even know where to begin. And so we at the health department, we want to be a resource, and we're trying to find ways of how can we be that resource for the community. The mapping tool is really a tool that we want to utilize to start a conversation. To have a local foundation like the Community Foundation of Northeast Iowa is tremendous, because this is the kind of support that you want at the local level. It's a support that is indicative that local foundations are willing to support a cause that is great. It's really important for us to have that common understanding to achieve a common alignment of how we're going to address this. The inequities within our system is affecting all of us. It's important that we all contribute to help move the needle forward.